This conference will now be recorded.
All right, welcome back. As was previously stated, the first three presentations are on the YouTube channel RENR Review. You can go there and you look at the first three presentations. This is the fourth presentation in our Mastering Multiple Choice Question Technique for nursing students broadly, but more specifically for those persons who are sitting there. RENR, the Regional Examination for Nursing Registration. Now we are looking at the techniques for the exam itself, the day of the exam, during the exam, cognitive strategies for peak performance. And this is key. Some persons fail the exam not because they don't know the content, but they tend to get carried away with the time, or they tend to get very anxious. So one of the things that you want to do is to maintain your awareness of time without creating any pressure on yourself. So what you want to do is perform periodic time checks at regular intervals. I have 10, 15, but maybe every half an hour, you should have completed at least 25 questions. So you want to ensure that you're on track to complete the exam within the specific time and that you would have covered every question. You can adjust your pace as needed while maintaining your accuracy. You want to avoid clock watching, so don't look every 5 minutes. As I said, every 30 minutes would be fine. So you can do time checks at 25 questions, which should be half hour. 50 questions, which would be an hour. 125, which would be 1.5 hours. According to research, strategic time monitoring improves examination completion rates. One of the things that you want to do is to use positive self talk. Yes, I can do this. The paper is inanimate. I am the person who has life and I control my destiny. So you use positive self talk to maintain your confidence and your focus. Replace negative thoughts, I don't know this, with constructive alternatives, such what do I know about this topic? I'm going to use what I know to answer this topic. Avoid catastrophizing. So what? You missed that one question. That one question, you come back to it. Don't give up and get downtrodden and get sad and depressed because you missed a question. Move on. Use personalized affirmation. I can do this. I am prepared. I studied. So I'm going to conquer this test. Acknowledge anxiety without judgment when it arises. Yes, I'm anxious, but I will overcome this because I must pass this test. It's not an if moment. I must. I will. Maintain a growth mindset about challenging questions. According to research, on the psychological basis, using positive self talk reduces anxiety and improves cognitive access to knowledge. It's when you get anxious, your mind is locked up. When you give yourself that positive affirmation, anxiety goes down and you are open up to the wellspring of the knowledge that you would have gained while studying. How do you implement the positive self talk? You're going to develop at least 3 to 5 go-to phrases for difficult moments. I can do this, or Philippians 4 verse. Let me see who know their Bibles. It's Philippians 4. Hello?
4:13.
I can do all things through Christ who gives me the strength. I studied, because I'm going to use pattern now for my Trinidad. I study, so I can do this. When the moments of doubt come, the blood of Jesus is against you. I have this. And by the way, I've been to university 4 times, and I'm not sure enough no people. When I sit in an exam, feeling is never in my head. Because if you think that way, you would have defeated yourself before the exam began. You must have only positive mindset. When they did the exam once, twice, or thrice already, you go into that exam, it's the first time you're doing it, and I'm going to beat up this exam. You're going to apply clinical reasoning frameworks systematically. Can somebody tell me the 4 clinical reasoning frameworks that we mentioned today? We did 4 today. Anybody remember any? We did ABCN, right?
Oh,
We
yes, sir.
also did Maslow, and we did ADPI, nursing process. And we also did this one. When asked to prioritize or which action to take first, we are going to look at an option. Which option, if not done first, will cause the patient to get worse or cause the patient to die? Everybody remember that?
Sir.
Yes. Another thing that you need to do, and ladies and gentlemen, you need some knowledge, because some of the clinical questions, they have to know the underlying pathophysiology to guide you. That's another one. That's number 5. Consider patient safety as a primary filter for options, and that's Maslow. You're going to apply ethical principles of autonomy, and this is bioethics. Autonomy, beneficence, non-maleficence, justice. And by the way, those you can memorize. I expect you to memorize those. Use nursing process, we did that already. Consider developmental and cultural factors. That's number 6. So there are something that will happen to the very young, something that will happen to the very old, and there are some conditions that are cultural. There are some conditions that happen to the Caucasians that don't necessarily happen to blacks. There are conditions that happen to blacks that does not necessarily happen to the Caucasian. Bear those in mind. Ladies and gentlemen, once you know the frameworks, you have a structured approach when you're uncertain. So what you do, you look at a clinical question and you're not sure, you drop each of the framework on it. Sorry for my patois. You place the framework alongside the question and you match which one works best. Sometimes more than one of the frameworks can work on a question. For example, you might be able to use A, B, C, N, and Maslow on one question. Did I lose anybody?
No, sir.
mentally walk through the appropriate framework for each question. So you're going, when you look at the clinical question, people, and by the way, why I'm specifying the greater number of the questions are clinical questions. When you look at the clinical question, you look at your med-surg, your peds, your obstetric, your psyche, your let's stay with the psyche. You look at the question and you ask yourself, of the 6 frameworks, which one works best? People, if you know the frameworks, at least 25% of your worry would be ended. Let me say that again. If you know the frameworks, 25% of your worry would be over. Because it would help you to prioritize the question. Clear? Hello?
Clear, sir.
All right. During the exam, so we're looking at advanced cognitive techniques. Ladies and gentlemen, a 2-way for you to pass multiple choice. Knowledge and technique. Only 2 ways. Most of the classes, they only teach one thing. Rote. And they skim the techniques. That I can tell you. When you're uncertain, use strategic educated guesses. Let me tell you how this is done. In the RENR, in the CARICOM region, our questions have 4 options. Now, 2 of the options are close. You have one of the distractors, which is close to the key or the correct answer, and 2 are not very close. So the first thing I expect you to do, get rid of the 2 that are not close. How is that done? You look at the options and you match it against the subject, as we would have done in video 1 and video 2. You match it against this subject, and once they don't match, you eliminate both of them. Clear? Hello?
Yes, sir.
You
Yes, sir.
eliminate them. When you're left with the next 2, you are going to go back and you match both of them with the stem, the subject, the issue or the problem in the stem, the key term, first, safest, best, and what you are asked to do. And the one that comes the closest to answering, that is the one that I'm sticking with. Hello?
Yes, sir.
Here is the next technique. I think in video 2. If you choose an answer and you can't find anything to say it is wrong, leave it. If when you look back at the answer and you're not 100% sure say it wrong, do not change your answer. Say it a 3rd time, because many students who fail the RENR, that's what they're going to the exam and do. If you're not 100% sure that your answer is wrong, leave it. So I said that 3 times. The 4th bullet, looking at the 4th bullet, consider what the question is really testing. Often it's safety or priority. You have to test. Use nursing principles when specific knowledge is lacking. So if your knowledge down, use the principles that you were taught. I think this the next bullet would be either in video 2 or 3. There is a rule in multiple choice. And I want you to listen, and if you have to write it down, gentle people, write it down. There are times when one of the answers contain parts or all of the other 2 or 3 options. Everybody got that?
Yes, sir.
There are
No,
times,
sir.
I want you to listen carefully. There are times when one of the options contain parts. Let's say option A. There are times when option B and C and D are part of option A. Is it any clearer, Mark?
Yes, sir. Yes, sir.
No. When this occurs, Chan, am I clear? Am I clear to you? Hello? Chan? Not hearing me?
Yes, sir. Got you.
All right. Rampasad, am I clear? All right, maybe Rampasad is busy. I just want to be sure that I'm Venture. Am I clear?
Yes, sir.
I'll repeat one more time. There are times when 2 or 3 options are included in one of the options. Please note, and I'm on bullet 1, 2, 3, 4, 5, 6. The one that is the most comprehensive, meaning that it contains the others or elements of the other 3 options, it is the correct option. Say it one more time. The answer that is the comprehensive or the umbrella term, comprehensive or umbrella. So I'm putting the 2 terms there. So you must look at your options. The one that is most comprehensive, it covers the other 3. That's your answer. Please note, when you guess this way, the way how I'm teaching you to do, research says it gives you a statistical benefit. It improves your odds from 25 up to 50% having gotten rid of the 2 waste options. The 2 options that are far out. Implementation, people write this down. Whenever you're doing multiple choice at this level, always eliminate at least 1 before you begin to guess. And if possible, eliminate 2. And when you are left with the 2, go back to your stem, match it against the subject, the issue or the problem, and against the key term, and against what you were asked to do. The one that best matches subject, problem, key term, and what you were asked to do, stay with that one. Does that sound like a good technique for guessing?
Yes, sir.
All right. Your exam on the RENR is 2.5 hours. So it's a long exam. How do you manage cognitive fatigues or fatigue? Recognize signs of mental fatigue, rereading and wandering thoughts. Take brief mental breaks between sections if permitted. Use micro relaxation techniques, deep breath, brief stretching. And what I would do, yeah, man, may have this covered, man. So I am thinking about when I finish and when I collect my pin and when I start get my first paycheck and when I go to the first hotel to have a nice meal or I go to watch a nice movie. So you take a little break, mini breaks. One of the things that I teach people to do, either the 2-pass, which I would have mentioned in slide in video 3, the 2-pass or the 4-pass mechanism. In that strategy, what you try to do, you try to go through the paper and you try to complete the simplest questions first. Doesn't matter where the questions are, number 100, number 80, number 50. What this does, apart from managing your cognitive fatigue, it gives you some money in the bank, gives you confidence, and decrease your anxiety. Because you would know, having completed the 30 easy questions, that you would have gotten someone right already. Does that make any sense?
Yes.
All right. The next thing you want to do, maintain positive internal dialogue throughout. I've got this. You're not going to defeat me again. You're dead. I am alive. I am the person with the pencil who's boring up the paper. And by the way, if you take up the paper after you shade it and you look on the back side of the paper, you'll see some little holes. So you have the paper and you are in control of your exam. Hello?
That's true, sir.
So 30-second mental reset, for example, after each 25, 30-second mental reset after every half an hour, or you can use what is on the page after every 10 questions. So we move to, and I'm going to do maybe another 20 minutes, and then we move. I will try to test you with some questions to see how you approach the questions. We'll try to do the slides not very long so you don't get bored. All right. Utilize question structure and patterns in a very strategic way. How is this done? Ladies, gentlemen, pay attention to qualifying words. These are called qualifying words or key terms and phrases. There are 52 of them. But I'm not going to burden you with all 52. They are usually in full scope on the RENR. These words include first, safest, surest, highest, greatest, most, best, summit, first, key, except, fundamental. I gave you about 15 just now. Why? These words modify what you are asked to do. Please jot that down. Bullet number 3, note when question contains except or not and adjust your approach. Now, people, there's a way of answering these questions. The easiest way to get rid of these is to cover it. Read the paper and you cover. By covering it, you will be looking for the positive response. Did I mislead anyone?
No, sir.
When you cover the except and the not, you will look for the positive response, and the one that is left will be your not and your except. Am I clear?
Crystal.
Why I'm asking you to cover it, these two words tend to confuse test takers. So you cover and you look for the ones that are inclusive, and the one that is left is the not or the except. All right. Look for grammatical clues between the stem and the option. Sometimes the one that doesn't grammatically fit the stem, they are incorrect. We do make that error as test makers. Recognize when multiple questions draw from the same content area. So sometimes in an exam, you have multiple questions drawing from the same content areas, and the student who is prudent and alert will pick that up and will turn and go back to the previous question. Any questions?
No, sir.
All right, what I want you to do is to develop a personal MCQ master plan. And I'm going to ask each of you now, determine where you are now in terms of managing MCQ. I want you to be honest, you don't have to tell me, give you a minute. Why I'm telling you to do this, it will dictate how hard you work. If you can correctly appraise yourself. So here's what I want you to do. Some persons know already, if you did the exam already, take out your nursing council slip and look at it. If you got less than 60% in any one of the areas, that's a weak area. So what I want you to do, the weak area, you're going to spend 2 times the amount of time that you spend on the strong areas. Am I clear? Hello? What I also want you to do, when I give you the questions which you have, I want you to look at the type of questions that give you trouble. And you're going to focus on those types. Is it the types that with first, best, most? So you're going to mark those that give you problems. You're going to evaluate your test taking habits and your emotional responses. And in the mock exam, sorry, I have given you the baseline already, 75. Why? Ladies and gentlemen, you can't work with less than 75. Why? When you go in the real exam and you drop, it is suggested that you usually fall by about 10 marks. Any questions there?
No, sir.
Strategy selection. Choosing appropriate approaches. Select study techniques matching your learning style. What I will say this to all of you. Every one of you, you have internet, whether you're in Barbados, Trinidad, Bahamas, Jamaica, you can study as a group. Am I clear?
Yes, sir.
You can't study by yourself. Yes, you're going to do individual study first, but at this level, group study is a priority. It is essential. Did I make myself clear?
Yes, sir.
You want to be adequately prepared for the exam, you can't study by yourself. I generally understand things easily and I've never studied by myself. The 4 times I've been to university, I've never studied by myself. You are setting up yourself for disaster. Select your study techniques to match your learning style. Identify resources addressing your specific needs. Now, in this review class, I have given you the resources, as I said before in one of those presentations. Nurses Lab has some very good clinical questions where you can test yourself. You go, you click, you get back the answers and the rationale just like on my YouTube channel. You click, you get the answers and you get the rationale immediately. You can do the nurses lab on your phone just like on my YouTube channel. You can do it on your phone. And once I upload information to the YouTube channel, once you are subscribed, you immediately get a link that new questions are added. Create an anxiety management plan if needed. Choose appropriate practice resources and question banks. I will say it again. You do not need to go looking at other people's classes. Hello? My class alone has more than 60,000 questions. And if you put that with nurses lab, you don't need to go and look in anybody else's class. Hello?
Yes, sir.
And I have
Yes.
said that you don't need to be jumping classes. You're coming to me, you're coming to VHSI, you're going to nursing focus. People have to themselves. You are setting up yourself. People, I took the time, and as I've said to you, my questions have been developed from the nursing curriculum or curricula used throughout Caribbean countries. My questions were set from the text books. Some of the questions, about 2,000 plus, I would have sent to 6 in the past. I'm not going to tell you which ones. Those I would have integrated as well. Ladies and gentlemen, man, to be successful, you have to plan. It's not to run go one class and you swat out 500 questions and say, oh, yes, I'm ready. Yes, you might be lucky, but two things. You may pass, but your practice at that registered nurse, when you start, you're going to have a problem because you're not going to do anything. That which is learned by rote, according to David Osabel, by the week or the month finish, you don't remember. No? I have tried to get people to think when they come to this class. Yes, you're getting the same information plus when they come to this class. All right. Create a structured study schedule, and I've done that for you. Create a structured study schedule with specific activities. Bullet number 2, practice with increasing difficult questions. You see that workbook? That is in the classroom, the online classroom. Good book. You see the workbook, good book. You see the mock test and the miscellaneous, good practice. Ladies and gentlemen, after each week, I want you to assess yourself and to see where you are and to see where you are falling down, to see where you are weak. Measure your progress and adjust as needed. You are going to track your performance improvement in targeted areas. So I'm weak in leadership and management. It means if I used to spend 1 hour, I'm going to double it. If I used to do 20 leadership and management questions, I'm going to do 40. Please note when you come to class, speak up. Don't sit in the back with your mouth shut. And by the way, when you come to a class, you are neither right nor wrong. You come to learn. And if you knew, you would not be in a class. So don't feel pressured, so you keep silent. You talk. Study with persons to get your feedback from your group members. And if you're doing something that is not correct, you modify your strategy based on your performance. And that's why I'm giving you 15 mock tests, and I want you to gauge yourself. Celebrate improvement while identifying new challenges. So let's say you're doing well. No matter go out, just buy yourself some nice meal or a nice drink, something like that. The going out will be left until when you pass the exam. The psychological aspects, so I have 10 more minutes. The psychological aspects of MCQ success. How do you build test taking confidence? Ladies and gentlemen, it is better to over prepare. As a student, 4 times, let's say 5 from my CXC, I have always tried to over prepare. Why I can't lose? Anything I would not have used in the exam, it spills over into my role as a registered nurse. So when you over prepare, you can't lose. Most persons are just trying to do the basic, as I said, to get few papers and that's what, and they study. That's what they call study. Recognize that confidence comes from preparation, not personality. And you'd want to get to somebody who can help you. It's not the hype and the bling bling. You must be able to identify who is the best person who is best suited to assist you. It's not the bling bling. And I'm not saying that I'm the best person, but I am not in the bling bling. There is not the personality. I'll give you this. I had a student who came to MCU. For some reason, I was not her most favorite person. There were 3 of us in Jamaica doing the review at the time. I was shocked when the girl stepped up in my class with an envelope. I was face to face. She stretched the envelope towards me and she didn't look at me. That young lady had sense. I wasn't her favorite person, but she thought I was the best person to assist her. So she stepped up. And I'm saying the same thing to you. You should be able to identify who is the best person to assist you, not necessarily following the crowd. We did speak about practice positive self-talk. So we got to acknowledge improvement and success, however small. So if last week on the first mock test you got 65 and you move to 70, celebrate it. Develop realistic expectation based on level of preparation. Now, ladies and gentlemen, if you know you never study well and you fail, don't beat up yourself because you would have gotten what you put in. We already spoke about managing test anxiety effectively. Understand the difference between helpful and harmful anxiety. Mega fail, I'm going to fail, I'm going to fail, I'm going to fail. You can't go in an exam with that. Recognize personal anxiety triggers and symptoms and manage them. Develop pre-exam relaxation routine. Practice grounding techniques during the exam. Create contingency plans for anxiety spikes. And develop growth mindset for testing. Let me say this to all of you. Is anybody who go to university and finish? You can't call any of them adults. Because in the Caribbean, it's a small population, small percentage of our populations that attend university. What tends to happen? How you perform on the test is a reflection of your current knowledge, how you studied. It's not a reflection of your ability. There was a young lady who failed RENR 3 times. Today, she has the bachelor's degree. She has a master's degree, a teaching degree, and a PhD. Was she a dunce person? Hello?
Definitely.
She was never a dunce person. She failed the RNR 3 times. 2 times, sorry. She passed it on the last chance. She was not a dunce person. It was a reflection of her knowledge then. And the person I'm telling you about is my very, very good friend. Interpret mistakes as learning opportunities. What I don't want you to do is to make the same mistake twice or thrice. You can't be failing the exam and it's the same areas you're failing. It means that you would not have reflected and you would not have used visioning. You can't be making the same mistakes. Focus on improvement rather than perfection. You don't have to get all the areas correct. If you can master the major areas, and let me tell you the major areas: nursing practice, leadership and management, clinical decision making and intervention. Yeah. If you can hit off those 3 areas, yeah. Separate your self-worth from your test performance. Your performance on the exam doesn't say who you are. Hello? And stop beating up yourself.
Yes, sir.
Practice with full-length exam to build confidence. People, that is why I'm giving you the mock test. The workbook, you do 100 questions per week. Yes, for the workbook, you can use your textbook, you can use your internet. But for the mock test, just you and quietness, no phone, no internet, no textbook, you and your pen or your pencil only. Next thing I want you to do, and it's bad, I am recording this, and I tried not to badmouth my colleagues, but I heard one of them telling students to study up to 11:30. There's no research in teaching and learning that tells anyone to sit up the night before an exam to study. I don't know of any research that says that. You want to be in your bed at 9, 10 o'clock sleeping, getting prepared, getting your brain rested for the day's hard work. And I know that there are those of you who did the exam before and you were told that you must set up and study till 11:30. Am I right or wrong?
You're right, sir.
That's nonsense. Please note you need to eat usually at about midday. If my pathophys is correct or my AMP is correct, you have a little fellow named the amygdala. When it needs the glucose for the brain, it is going to pull the glucose from the areas that are not critical, from your arms and your legs. And you're going to realize that at about midday, you can't think, your hand them can't lift up. Yeah, because the brain needs the glucose to think, so you must eat. Not a fried dumpling or a fried chicken, 2 bananas, 2 pieces of yam, a piece of saltfish, a piece of mackerel or sardine, some vegetables. Yeah, you want to create a supportive learning environment. If you have families, husbands, boyfriends, and children, they need to be in the setting with you. You need to say to them, on a Thursday I have class, on a Sunday I have class, and on a Tuesday I have class. And at this point, say to the gentleman, you're going to keep the child, and this is my study period. Because your studying is for the family. Am I making sense?
Yes, sir.
When success comes, it comes for the entire family. So your husband or the gentleman not supposed to be expecting you to be cooking, changing diaper during study time. Hello?
Yes, sir.
3 more minutes. Identifying study settings that optimize performance. When you are selecting study partners, select people who will enhance your learning. They must be able to add something. You don't select dummies. They come into the study setting and they pull everything from you with nothing to add. Those people, those persons are dangerous. Develop boundaries with negative or anxiety inducing peers. So if you have these people studying with you, you cut them off. Study time is not for negativity. Communicate needs to family and friends. I said it already during intensive study period. So I don't expect, let me say this to you, your child needs your time. And I hope you sat down with the child, and a child of 2 can understand. And I hope you'd have said to your partner, this is the time. When I pass the exam, it is going to be easier for you because things I can buy for myself and things I can buy for the child. So it's a partnership. create balance between academic preparation and personal well-being. For those who are working, I'm sorry for you. Because my thing when you're studying, you study between 5 to 6 hours per day. And if you work 8 hours, I don't know how you're going to put in that 5 hours per day. If you're not working, I expect you to start studying from 7. And you stop 7, 8, 9, 10, 11, 12, between 12 and 1 o'clock. For each hour, you give yourself a 10-minute break for each hour. For those who have to work, if you work for 8 hours, you come in at 3 for the first hour, 3 to 4 you don't do any studying, then 5, 6, 7, 8. You stop at 8 o'clock. Does that make any sense? Hello?
Yes, sir.
It is only spent studying alone, answering the other persons that are not responding.
Yes, sir.
Yes, sir.
So I am mapping out a way for you to study. Because you still need a little time for yourself. All right, so after we are finished with this now, we are going to go to the domain techniques. Conclusion. The journey to MCQ mastery. Key takeaways for immediate implementation. MCQ success requires both content knowledge and a strategic approach. It's not just swatting. Please note, test taking skill is learnable and it improves with your practice. I've learned it. I had 3 students, and I must speak to these 3 students because they nailed it down to a T. They got the techniques, and every question they looked at, they could see a technique. And analysis of errors provide the foundation for improvement. There is a slide somebody remind me to look at. Test taking errors A, B, C, D, and E. Physical and mental preparation significantly impacts performance. So you must do the work. And so this concludes the 4th video presentation. And those of you who are on, I want to encourage you to go back and look at this slide. I'm going to put it on the RENR channel on YouTube. All right? And I'm encouraging you to like, to subscribe, and to share.